All right, welcome back to the deep dive. Today we're diving into aminoglycosides.
Oh, yeah.
They're a pretty powerful class of antibiotics, and our mission here is to really figure out what they are, how they work against bacteria, and why they're both super important, but also come with some risks. We've got some scientific overviews we'll be pulling from to help unpack all of this.
Yeah, I think the thing that's really interesting about these is that they're broad spectrum.
Mm-hmm.
So they work against a wide range of bacteria.
Yeah.
Especially when it comes to those really serious gram-negative infections.
Right.
And they even can help other antibiotics work against some gram-positive bacteria.
Okay.
But at their core, they really just stop bacteria from making proteins. That's how they kill them.
Okay, so structurally, what are we looking at here for these molecules?
Well, they've got these kind of sugary parts linked to a central ring, and that structure makes them very charged and very, very water soluble. So what that means is they don't get absorbed if you take them as a pill,
Right.
and they don't really get into your central nervous system very well.
Okay.
And really, your kidneys are how you get rid of these things primarily.
Okay.
And streptomycin is a good example of kind of a classic aminoglycoside
Yeah.
that follows this kind of structural layout.
Okay, so now for getting into how they work, inhibiting protein synthesis, that sounds pretty general.
Yeah.
But what is it that they're actually doing to these bacteria?
Right. So there are, a lot of specifics that are important to understand here. First of all, they need oxygen to actually get inside the bacteria cell.
Okay.
So they're not going to work against bacteria that don't use oxygen.
Right.
They grab on to that outer layer, especially of gram-negative bacteria,
Uh-huh.
which really helps them get in. Then they bind to this really important part of the protein-making machinery of bacteria called the 30S ribosomal subunit.
And so the ribosome is like the protein factory, right, for bacteria.
Exactly. That's exactly it.
Okay, so what happens when they bind on there?
So they disrupt the factory in a few ways.
Yeah.
First of all, they can cause it to misread the instructions.
Okay.
So it starts putting the wrong building blocks into the protein.
Okay.
Second, they can just stop production prematurely. So you get incomplete proteins.
So they're just not functional.
They're not functional at all.
Gotcha.
And then third, they can actually physically block the factory from moving along.
Oh, wow.
So it can't continue that protein production at all.
Okay.
And this can lead to kind of damage to the bacteria beyond just the protein synthesis.
Gotcha. Okay, so we're talking about, you've mentioned a few examples here and there. What are some of the key players that we should know?
Sure. So gentamicin is one that's really widely used.
Okay.
And it's really effective against some of those tougher gram-negative bacteria like Pseudomonas.
Right.
It can work with other antibiotics too against gram-positive infections like endocarditis, for example. Tobramycin is similar but a little bit better against Pseudomonas.
Okay.
And it can even be inhaled to help with lung infections in cystic fibrosis patients.
Oh, interesting. Okay.
Now, amikicin's kind of reserved for when things get really serious.
Okay.
So it's semi-synthetic.
Okay.
And it's got a broader reach because it can resist many of the kind of defenses that bacteria have that might deactivate other aminoglycosides.
So it's like the big gun, huh?
That's right.
Yeah.
That's right. And then we have streptomycin. So streptomycin is a very historic one, the first one discovered, still important for tuberculosis, plague, tularemia, although resistance is unfortunately pretty common.
Right.
And then finally, neomycin. Neomycin's a little different. It's really too toxic to give by injection.
Okay.
So it's used topically, on the skin or orally to clear out the bowel before surgery because it's not well absorbed.
Okay.
So it's got its own little niche there.
Gotcha. So clinically, where do these drugs fit into treating infections?
Well, I mean, they're really crucial options for severe gram-negative infections. So think, bloodstream infections, pneumonia, the kind that you might get on the hospital, complicated UTIs,
Okay.
infections inside the abdomen.
Right.
So really serious stuff.
Yeah.
They're also, like we talked about, key partners in treating, some of those more difficult gram-positive infections.
Mm.
And then certain specific diseases like tuberculosis.
Yeah. Yeah. Okay. And then we've mentioned that there are some downsides, some significant downsides.
Oh, yeah, definitely. And that's why it's so important to monitor the levels of these drugs in the
Yeah.
body,
Right.
really carefully. So the main concerns, are kidney damage.
Okay.
We call that nephrotoxicity.
Right.
And that usually gets better if the drug is stopped.
Okay. So it's reversible.
Usually.
Right.
Another one is ear damage, ototoxicity.
Oh,
And that can cause permanent hearing loss and balance problems.
wow.
And then very rarely, especially at high doses, they can cause muscle weakness, which is a concern for certain individuals.
Right.
So, yeah, there's definitely a lot to keep in mind when using these drugs.
So how do bacteria fight back against these aminoglycosides?
So they've got some pretty clever tricks. The most common one is enzymatic modification.
Yeah.
So they actually produce these enzymes that change the aminoglycoside.
Right.
So it can't bind to that ribosome anymore.
Gotcha.
They can also just reduce how much of the drug gets into the cell in the first place.
Makes sense.
Um,
Yeah.
And then less often, they can even change the target on the ribosome itself.
Oh, wow.
So it's an arms race.
It is.
They're always trying to find ways to get around these drugs.
So where do they actually come from? Where do these aminoglycosides, where do we find them?
So they're actually produced naturally by fermentation,
Okay.
by soil bacteria,
Oh, wow.
mainly from the Streptomyces and Micromonospora families.
Okay.
So, for example, streptomycin, that comes from Streptomyces griseus.
Okay.
And then gentamicin comes from Micromonospora purpurea.
Gotcha.
Gotcha. So, nature's got a lot of these interesting compounds. Yeah, it does. Well, that's really interesting. So, to kind of wrap up, aminoglycosides they're potent, they're broad spectrum antibiotics,
Mm-hmm.
and they're really vital for serious infections,
Yeah.
especially gram-negative ones. But their potential for toxicity
Right.
means we have to be really careful how we use them.
Okay.
And bacterial resistance, that's a huge ongoing challenge.
Yeah, it really is. And it kind of makes you wonder, you know, given all this, given how they work, given how the bacteria are fighting back, what's the future of this class of antibiotics going to be like?
Yeah.
As resistance continues to rise, what are we going to do?
Yeah.
So it's an important question to consider.
It is. It is. Well, this has been another great deep dive. So thanks for joining us, and we'll see you next time.
Sounds good.